Because diabetes is a vascular equivalent disease, it affects almost all the organs of the body. It is something like a tree which is looks like it is standing firm, but at the same time it is all hollow from inside, that it is been eaten up from inside, and then it falls. Till the time it falls, it appears that tree is standing, so looks like okay. So that is one of the similes which I can give of diabetes, that how slowly it can eat up most of the organs of the body and leads to failure of so many organs. One of the common organs which it can affect is the heart. Now, heart can get affected in a number of ways. It can get affected, number one, if the arteries supplying blood to the heart get affected. There are cholesterol depositions in the arteries, which are much more often seen in diabetics, because diabetics are very often associated with high cholesterol levels, high triglyceride levels in the blood, and other risk factors like high blood pressure and you know many other problems like high creatinine, kidney affection. They are common, and they all lead to more deposition of cholesterol and other related products in the arteries of the heart. And then what happens, and the artery can get blocked and the person can get a acute heart attack. The blood also in the diabetics is little abnormal. The platelet activity is heightened, so that the clot formation in the arteries is more rapid as compared to others, and that leads to unstable angina, stable angina, heart attacks, and heart attacks can lead to weakness of the heart muscle, lead to heart failure. So these are some of the common ways in which diabetes can affect the heart through the involvement of coronary arteries. But today we know that half of the patients of diabetics can have cardiac problems without affection of the arteries of the heart muscle becoming weak. Diabetics are more prone to heart failure. Now it is a very general information for all that patients who are diabetics develop heart failure faster. If you have any patient of any population of heart failure patient, you will find that a large number of them are diabetics without having suffered a heart attack. So diabetes directly affects the heart muscle. It makes the myocardial contraction, that is the contraction of the heart, weaker. It also leads to some of the problems like fat deposition in the legs, peripheral vascular disease. Person, when he walks, he gets pain in the legs, and at times he feels this is just fatigue because of spondylosis or some vague thing. But if you get the peripheral pulses felt or do a ultrasound, Doppler, or what is called as the ankle brachial index, you find that there is a involvement of the arteries of the legs, and ulcers can form. And since the blood supply to the smaller fingers and digits and becomes much less, they can form gangrenes, because the small vessels, those tiny vessels which cannot be seen even on angiogram, get affected, and it leads to what is called as a diabetic foot. That means that the foot is affected. There are ulcerations. You go on dressing them, get them cleaned, but it just doesn't heal, and it's not infrequent that these fingers are to be amputated. And this is a very serious problem in diabetics. That's why the examination of foot and foot care is extremely important in diabetics. The other problem is that diabetic also affects the nerves. Now, when the nerves are affected, the sensation of pain is blunted. If the sensation of pain is blunted while the person is walking and he just hits a stone or gets injured, he doesn't feel the same amount of pain which the non-diabetic gets, and as a result of it, it gets neglected till the time he sees that finger or the thumb is already swollen, and then he goes to a physician or a surgeon and he sees that it is badly affected. So the peripheral vessels, the peripheral nerves, they get affected, and as a result of which the peripheral vascular disease becomes a major problem. So heart problem, as I told you, because of heart attacks, unstable angina, heart failure is common. In diabetics, similarly, the peripheral vascular disease is common. Eyes get affected once again because of the eyes have got an abundant blood supply, and the blood supply to the eye, if it gets affected because of affection secondary to diabetes, these tiny vessels, the micro vessels, microvascular problems in the eyes lead to lots of changes in the eyes, diminution of vision, blindness is one of the common causes of blindness, can be advanced diabetes. So examination of the eyes also becomes very important in the diabetic. And kidneys, which are very, very important organs, they filter all the blood which the heart pumps. They also get affected by diabetes. They get affected from in many ways. What happens is that the albumin or protein starts coming out of the kidneys, abnormal filtration, and protein loss, even micro albuminuria is a serious problem. That is the reason every diabetic should have a urine examination done. And if there is a microalbuminuria, it is a serious risk factor for vascular events like a heart attack or a stroke or similar things. So one should be very, very careful about these factors also, that the kidneys are to be examined, the urine is to be examined. Then very often you find that their creatinine clearance is lower. It normal is more than 90. Very often in diabetics between 60 and 90, and between 30 and 60, and less than 30 is very, very low. That means stage 5 chronic kidney disease. So all these problems are frequent in diabetics, and unless they are checked in time, they progress gallopingly. Diabetes is very often associated with high blood pressure. At least half of the patients above the age of 45 years who are diabetics, their blood pressures are high. And this combination is also called a kind of a malignant duo. That is a very bad combination because it adds to the insult to all the organs. It leads to major issues. The heart attacks, strokes are much more if diabetes is present along with high blood pressure.